just want to pop you over to what seems to be an impromptu briefing by Health Minister Doctor Aaron Motsoaledi, who's today launching a new HIV treatment campaign in Soweto. In fact, it's happening at Chris Hani Baragwanath Hospital. Let's listen in.
Whereby we are going to look for 1.1 million people who are known to be HIV positive, but are not on treatment. Either they were, they've stopped, or they've never even started treatment. We are doing so because we want South Africans not to get used to the idea that there's a disease called HIV and AIDS, and it's there, and we are going to live with it, or we are going to live side by side with it. We don't want that, because that should not be, excuse me. They must know that we must eliminate it. We might not eradicate it, but our aim is to eliminate it as a public health threat by 2030. And the system we are going to use has been defined by UNAIDS, called 95-95-95. That 95% of the people must know their status. And those who are positive, 95% of them, must be on treatment. And those who are on treatment, 95% of them, must be virally suppressed, meaning they must not have a capacity to transmit the virus to the next person, even when they remain positive. Once you reach that stage where 95% of the people are virally suppressed, then the virus is not being transmitted. Then we are okay, because at the moment, we are still getting 150,000 new infections every year, which means the virus is still being transmitted. But only that, unlike some 12 years back, 15 years back in 2010, people sort of are no longer scared, because they say, no, HIV/AIDS can be under control. You can take treatment and live a normal life. We know that is so, but we don't think we should accept that we must live with this disease. It must go. And that's why we are looking for those people in order to reach our 95-95-95.
What are some of the techniques and tools and outreach programs that will be done to reach that 1.1 million people?
There will be many. First of all, we took the 1.1 million people and divide them province by province. Because when you look at the figure of 1.1, it's scary. It's quite big. But when you divide it province by province, you start realizing, I know that Eastern Cape, for instance, need to look for only 140,000 people. So it's no longer scary when you do it that way. Then within Eastern Cape, there are 7 districts. When you go to divide it into those districts, it's much, much less. Then you divide it into health facilities. You may find that one hospital or clinic only have to look for 3 people. And that's very manageable. Only have to look for 3 people who are taking treatment there.
Apologies, looks like we've lost our connection there to the Health Minister, Aaron Motsoaledi, speaking at Chris Hani Baragwanath Hospital. It's all part of a new campaign, if you like, renewed vigor to try bring HIV infections in the country under control. Just because the virus or the disease isn't making headlines doesn't mean it's not spreading. In fact, the minister telling us there that there are 150,000 new infections every year in the country, and that's why they're ramping up their efforts to bring the situation under control. The minister still speaking. Let's continue listening in.
Tested, who came to test for HIV/AIDS, 65% of them were women. 65% of them were women. The remaining were men and children, but 65% of the people. So in this battle, they've done very well. Not surprising that men are lagging behind, but we know that the transmission goes mostly through men. So we are looking for them. And unfortunately, men are the people who are never found in clinics. Their healthcare seeking behavior is very low. Now, we just heard also that you also don't find them in church, In church, yes, because they tend to believe that women represent them everywhere. When you ask a man, why don't you go to church? They say, no, my wife goes. And when we started this campaign, we were asking some men, why don't you test? He said, no, my wife has tested. So it's a very big problem that the women must fight this battle alone. It's high time that men must come to the party to help us fight this disease.
Minister, there's been some uncertainty around funding, specifically around the AIDS treatment, given the sentiments of US President Donald Trump. We've heard from some organizations that they were exempted from this 90-day suspension, but there's still uncertainty around there. How is South Africa trying to make up for that 17% or some of the clinics that are facing either shortages or closing down due to these uncertain times?
Let me start here. In 2010, when we launched this campaign, we said we wanted to launch the world's biggest HIV counseling, testing and treatment campaign, which we have done. The 5.5 million people is the biggest number in the world. The first question we asked was, can you afford it? I've always refused to answer that question. I said, you are asking a wrong question. The question you must be asking is, can we afford not to treat people? That's the question that will guide you. Can you afford it? And I'm answering it today.
Having quite a field day with our feed there to the health minister, and he's saying such important sharing such important information, responding to questions there around the PEPFAR funding that's been cut from the US. We know that, of course, 17% of South Africa's health treatment was funded through that foreign aid from the United States, which has now been affected, it seems, as the US's relationship with South Africa sours. Although it seems there was clarity, actually, that was communicated through diplomatic channels suggesting that emergency funding, including PEPFAR, won't necessarily be impacted by the US's decision to cut emergency funding to South Africa, amongst other countries. But we'll certainly get you the rest of what the minister has to say with our reporter Hasina Gori, who's also at the hospital at the SAWA. But essentially, if you've missed it, he's at Chris Hani Baragwanath Hospital, the minister, to launch a new campaign aimed at finding about 1.1 million people in a desperate attempt, of course, to claw back on the spiraling number of infections in the country. 150,000 new infections of HIV, we're told, are still being registered. And part of what government is hoping to do now is really drive through that 95-95-95 initiative, which has the backing of the United Nations, essentially hoping to ensure that 95% of people know their status. Of that, 95% are on treatment, and of that, 95% have a virally suppressed load. All of this by the year 2030, just half a decade from now. So we'll get a sense of how all of that unfolds. I can see at the corner of my eye, it seems one of the officials at the hospital is speaking. I wonder if we can just continue listening in for you, get you a sense of what else they have to say.
End AIDS in children, that is our way of getting children back onto care. We know that key and vulnerable populations are not getting access to care, and they are also a particular focus area. And most importantly, we know that adolescent and young people are in need of prevention, treatment and care. So SANAC has galvanized all the SANACs within all the provinces to make sure that everybody hits the ground running to find the 1.1. The targets have been broken down to meet not just the 2025 targets, but also the 2028 targets for the National Strategic Plan for South Africa, by province, by district, and by facility, so that it's easier for them to find. Because the facilities know their patients. They know who is missing from care. And if they work with all the stakeholders, including the traditional leaders, the traditional healers, they'll be able to find them and bring them back onto care.
You speak about a very collaborative approach. How has been the buy-in from those communities on the ground? Specifically, men, you said the campaign is being spearheaded by men. What's that conversation that's been had, and are they willing to come to the party?
They have certainly come to the party. I think if you look behind me, you'll see Anne from the UN family. So the UN family has been coordinating the work that happens around ensuring a multi-stakeholder response. So SANAC's role is to make sure that the men, the women, the children, youth, all the sectors have come together. And this campaign in particular, we've spent a lot of time preparing and planning for it, and all the stakeholders were sitting around the table. The men put up their hands and they said, not in our name. We will not be found wanting when it comes to making sure that the gap is closed. So the stakeholders are sold, the private sector is on board, the civil society is on board, all government departments led by health are on board, and our development partners, despite the shifting geopolitics, are also on board. So we expect that we are going to be able to close this gap by December 2025.
Thank you so much.
All right, sir. So there you have it. An official there speaking on this new initiative to try find 1.1 million people in an effort to bring down HIV infections in the country. We'll continue listening in on that and get you a sense of some of the salient points that come out of that impromptu briefing.